infirmary was actually the former name of what we call a hospital. For a hospital was not called a hospital.
Hello, and welcome to the Built Environment and Health channel. In this episode, we will uncover the deep meaning behind the former name of a hospital. What does this word truly signify, and how does it reflect the original purpose of a hospital as a space for healing? Together, we will decode the construction of this topical former name of a hospital and understand why it was called so. By decoding just that former name of a hospital, we hope to prompt a deeper understanding of what hospitals were originally meant to be. I believe we have all visited a hospital at one time or the other. Like other spaces, the hospital-built environments can evoke a sense of security or that of fear and anxiety if the original intention for which reason it was set up, as we are decoding in its name, is lost. Let's go.
Inpatient, outpatient, indiscipline, inmates. There are ins here and there. But do they have the same meaning each time? No, they don't. Have you ever wondered their origin? It seems straightforward though. Maybe these will help me explain before we delve into the details of our discussion. Often when we say one is indisciplined, do we mean the person is indisciplined, as in they have discipline? No. We actually mean to say they lack discipline. They do not have discipline. They don't comply with disciplinary measures. You would realize that if we did say one was an inpatient or an outpatient, we actually meant that they were patients who were accepted to stay in the hospital for the purposes of treatment. But the outpatients were those that we could treat and send out. Those are outpatients. Sounds like a military term though. Inpatient, outpatient. What about infirmary? Have you ever heard the word infirmary? You may have heard, but you never understood what the detail of the word infirmary meant. So the word infirmary was actually the former name of what we call a hospital. For a hospital was not called a hospital. An infirmary, just like indiscipline, does not mean to be in a infirmary. No, that is not what it means. It actually rather means not having firmness. So an infirmary just comes from the word an infirm. An infirmary is a concept that explains one's state. The primary is a state of one being in their prime form. In that similitude, an infirmary refers to one being in an infirm state. But would we need to understand what the infirm state is? Yes. The infirm state, like the indiscipline, is not to mean that one is infirm. No. It actually means one lacking firmness. So one that is weak, unstable, not firm, that is an infirm. And the infirms are taken to the infirmaries so they can receive treatment for recovery. However, originally, infirmaries were derived from the legal perspective, where we know that a firm is a place where we have professionals trained to help advocate for one's needs. As such, when one takes his or her case to a legal firm, the lawyers therein understand first the situation of the client, and from there advances the approaches to use to exonerate him or her from the pending predicament. If he is guilty, they hope to reduce the sentence. That is what a firm is. From that same concept, the infirmaries were designed to host the prototypes from the legal firms, in this case being the health professional, the medical laboratory scientist, the radiographer, the medical doctor. You have a clear team of persons who will advocate for your recovery from what? From disease, from anxiety, from unwellness, from any form of bodily and soul recovery. The infirmaries were meant to do this. Because years ago, they understood that health was not just as we take it today. Years ago, it was very clearly understood that when one was unhealthy, the underpinning conditions were either infectious, non-infectious, and even with non-infectious, they understood sometimes it was merely psychological. And therefore, if you had a chance to interact with the person, you could take them out of the condition and restore them into default status as they were in the healthy condition. Today, we easily identify with a hospital as one that is equipped with advanced medical technology and usually with staff who have a wide range of medical professions, whereas infirmaries are now relegated to the background. They are typically simpler, provide less care for severe conditions, and often staffed with smaller medical teams. The hospitals and infirmaries still exist. However, the hospitals have been understood to be large medical facilities. Usually, they are in a building with multiple floors, and that is where serious ill or injured patients are given extensive medical and/or even surgical treatment. However, the infirmaries, interestingly, are like a clinic or a dispensary. Another term we give infirmaries, for which reason people may not easily identify, is probably a clinic or a dispensary within another institution. Hospitals tend to serve large communities, addressing a broad spectrum of health issues, whereas infirmaries are focused on serving the immediate community organizations. Let us understand something. It is getting interesting that if we talk of a hospital, it is actually a large medical facility where we have management of serious conditions. They are well equipped. There are persons with, diverse medical backgrounds. Yes, but a hospital again could be a building founded for the long-term care of its residents, such as an almshouse. The residents may have no physical ailments, but they simply need financial support. I believe you are thinking, wow, did the hospital actually even refer to those who were financially poor? That is it. The concept is that it is supposed to attempt to take care of persons by entertaining them, by sheltering them, and by even helping them financially, telling us that the original meaning of an infirmary is expected to be in the hospital where that need is lacking. This simple video is a call for us to review our hospitals, to begin to demand just environment that, on the contrary, will not plunge us into worsened health, whereas we went there with the intention to seek healing. I have a friend by name Emmanuel, a notable built environment that Emmanuel has grown to dread, to fear, is the hospital built environment. Emmanuel never returns home from the hospital without taking ill afterward, whether it is a regular health check or to visit a friend on an admission. He soon takes ill and recovers later. Emmanuel does not visit the hospitals any longer. No, he doesn't. Unless it is an emergency, I doubt what will take him there. The smell, the gory scenes, the injuries, he can't. I believe these things potentially are part of the reasons why he takes ill not long after he returns from any hospital he visits. They have tamed his urge to show up in any hospital. Which do you attend when you feel sick? A hospital or an infirmary? The original or the fake? Do you have the same experience, or do you know one? Faced with the same as Emmanuel, send me those peculiar experiences you have of different spaces and how you wish they could be redesigned to optimize your health. Let me have your comment.